Of note, Heinz to celebrate 75-year anniversary. BVA members and their families are invited to attend in person the 75th anniversary commemoration of the Central Blind Rehabilitation Center at the Edward Heinz Jr. VA Hospital, Building 113. The event, scheduled for Thursday, July 20, 11 a.m. to 2 p.m., will feature an open house, tours, distinguished guests, and light refreshments. The opening of the Heinz facility on July 4, 1948, was as much a milestone in BVA's early history as it was for VA. The organization's founders and leaders, supported by national chaplain and rehabilitation professional Father Thomas Carroll, pushed for quick approval and construction of the center, which continues to serve hundreds of veterans annually with a broad range of rehabilitation, education, and research/technology programs. Parties interested in attending the celebration should RSVP no later than July 13, 2023 to Heinz Public Affairs at va.gov. VA observes NCA's 50th birthday. VA's National Cemetery Administration, NCA, manages 155 national cemeteries in 42 states. Memorial Day ceremonies will be conducted this year in more than 130 of them. NCA also provides headstones, markers, medallions, and presidential memorial certificates for qualified veterans. While not officially designated as NCA until 1998, its administrative birthday is 1973, when Congress passed the National Cemeteries Act, creating an agency within the then Veterans Administration to oversee the national cemetery system dating back to the American Civil War. Some BVA members may be unaware of the burial benefits for which they are eligible. For information about the criteria for burial in a national cemetery, visit va.gov/burials-memorials/eligibility/. Get care now with VA Health Chat. VA's Office of Connected Care has announced a new mobile app that allows veterans, wherever they are, to exchange text messages with a VA healthcare team. The platform is a user-friendly one in which veterans can receive virtual health care from caring staff. Functions include medical advice regarding minor illnesses or injuries, such as congestion, rashes, or stomach aches. Also possible is the scheduling of appointments, questions about prescriptions, or refilling them, and deliberations about whether the veteran should be seen in person. Veterans can chat with a VA healthcare professional Monday through Friday from 8 a.m. until 4 p.m. in most locations. Some locations are available 24/7. For a secure experience, it is necessary to log in with VA-supported credentials using the My Health eVet Premium, the DS Login, or the ID.me account. To use the new service, download the VA Health Chat app from the VA Mobile App Store, the Apple App Store, or the Google Play Store. For additional details about the app and the list of locations offering health chats nationwide, visit https://mobile.va.gov/app/va-health-chat. Looking again at presumptive toxic exposure eligibility. Under the PACT Act, VA has expanded the list of health conditions that are now believed to be caused by exposure to hazardous substances. A new update helps generations of veterans and their survivors receive the care and benefits they have earned and deserve. Veterans with a presumptive condition do not need to prove that their service caused the condition. They need only to meet the service requirements for the presumption. For more information about eligibility for such benefits, visit https://news.va.gov/116593/accessing-toxic-exposure-health-care-benefits/. VA Mobile App Ads feature. The VA Health and Benefits mobile application added last month a prescription refill feature allowing veterans to conveniently view, refill, and check the status of their VA-dispensed prescriptions from their mobile devices. As is the case with each new feature, existing users must download the latest version of the app to gain access to the prescription refill function. If veterans do not see the prescriptions feature in the Healthcare tab after they download the latest version, they should completely quit the app and open it again. Adding RX Refill makes the VA Health and Benefits mobile app more useful and multifunctional for the more than 1 million veterans who have downloaded and are using the mobile app or who will do so in the future. The Health and Benefits mobile app is VA's official, all-in-one, on-the-go, easy-to-use, accessible, on-demand app enabling veterans to manage both their VA healthcare and their benefits services from their fingertips. For more information about the mobile app or to simply download it, go to https://mobile.va.gov/app/va-health-and-benefits. Obtain an ID card. Use it for various perks. A veteran ID card can result in free event tickets and discounts from retailers, restaurants, hotels, recreational activities, and dozens of other perks, including entrance into national parks. On Veterans Day last November, the National Park Service unveiled an unprecedented lifetime pass providing free entrance to national parks for veterans and their families. The pass encompasses more than 2,000 federal recreation sites spread out across more than 400 million acres of public lands, which also include wildlife refuges and forests. The pass is also available to Gold Star families. For additional details about this benefit and how to obtain the ID card, visit https://news.va.gov. There is a search function in which users should type in the keywords, quote, national parks, unquote, to learn more about the lifetime pass and, quote, veteran ID card, unquote, for more information about the card. VA radio PSAs offer wealth of useful information, resources. VA has both published and produced a series of 25 public service announcements designed for radio that highlight programs, benefits, and services for veterans and their families. The goal is to educate the public as well as the veteran population about these important resources. Although VA's outreach is targeted primarily to station managers who may wish to air the announcements, the PSAs are also available for download to anyone as both MP3s and transcripts. Most of the PSAs currently link to additional information on a VA webpage. Examples of the types of topics available are the PACT Act, VA Careers for Veterans, AARP and Veterans, Veterans Canteen Service, no-cost flu shots, new VA crisis line number, tax benefits for veterans, preventing scammers, and much more. To access a list of PSA topics and the links to the MP3 files and transcripts themselves, visit https://news.va.gov.outreach/radio. Reimbursements for VA travel. BVA members and other veterans with visual loss may not be aware that VA travel reimbursements pay back eligible veterans and caregivers for mileage and other travel expenses to and from approved healthcare appointments. On September 30, 2016, President Barack Obama signed legislation for which BVA had advocated for years that gave the statutory authority to provide travel benefits to catastrophically disabled, non-service-connected blind, and visually impaired veterans seeking rehabilitation services at VA facilities. Additional information about eligibility and the process of creating and getting help with a claim for travel reimbursements of all varieties is available through a search at myhealth.va.gov. VA updates 1959 mission statement, recognizes sacred commitment to all. VA announced in mid-March an updated version of its 1959 mission statement that is now inclusive of all who have served in the nation's military. The new mission statement is, quote, to fulfill President Lincoln's promise to care for those who have served in our nation's military and for their families, caregivers, and survivors, unquote. The statement also acknowledges the importance of women veterans, who now number more than 600,000 and constitute the fastest-growing cohort of veterans. It also recognizes the millions of veterans who did not serve in combat. Community coalitions and VA work together to end suicide. VA announced on May 18 its partnership with more than 1,000 local community coalitions engaged in ending veteran suicide. The coalitions, established through VA's public health model for suicide prevention, now reach more than 7.5 million veterans nationwide. By combining community coalitions with clinical intervention strategies, as outlined in VA's National Strategy for Preventing Veteran Suicide, these coalitions help reduce the risk of suicide by providing veterans with tailored resources and direct support in the communities where they work and live. One suicide will always be one too many, and it will take all of us working together to end veteran suicide, said VA Secretary Dennis McDonough. Quote, "We are working with these coalitions to support veterans at risk of suicide all across America, combining VA's clinical expertise with on-the-ground community interventions to save lives." Unquote. Bulletin format preferences requested. BVA currently produces the Bulletin in 5 formats. 1. Print version. 2. Professionally narrated audio version, available online at https://bva.org/the-bulletin. 3. Narrated email version, Word document, also available online. 4. PDF email version, also available online, an exact replica of the print version appearing on the screen just as it appears on paper, and 5. Condensed version on a compact disc. If you are not receiving the version or versions you may wish to receive, please send an email to info@bva.org or dial 202-371-8882. Except for those receiving a CD recording, BVA members wishing to receive multiple versions may do so.